There are now more organ donations and more transplants performed in Australia than ever before, but hospitals are struggling to keep up. Since 2008, federal government reforms have lifted donor rates substantially, leading to a record 931 transplants last year. But there are fears critically ill patients are still missing out on life-saving operations because hospitals need more staff and more resources, as Lisa Whitehead reports.
Since her first birthday, Patricia Shates has suffered from complications from diabetes, including blindness, numbness in her toes and fingers, and now at 28, her kidneys are failing.
4 days a week I go to dialysis. I have oodles of medication, everything under the sun.
For the past 8 months, she's been on the waiting list for a kidney and pancreas transplant to give her a second chance at life.
It's a roller coaster. I mean, your heart races every time the phone rings at night and you see it's a private number coming up. You just, in the back of your mind, you're like, could this be it?
Patricia Shates is one of the 1,600 Australians on the official organ transplant waiting list. But the reality is 80 people will die this year while they wait.
If I get a transplant in the next 3 months, then I die.
Radio broadcaster Darren Hinch is waiting for a liver transplant at Melbourne's Austin Hospital.
Last year at the Austin, Professor Bob Jones told me they did 54 transplants, liver transplants. He said to me, we could do double that, but we don't have the organs. He said, we have the equipment, they certainly have the surgeons, some of the best in the world.
The patients waiting for transplantation are all having those organs used appropriately by the current resources. But if the numbers increase, then it's quite likely that we will need larger and stronger transplant teams to deal with that.
Australia traditionally has had a poor organ donation rate, but it has improved dramatically in the past 2 years. Transplantation rates have also hit record levels. But Melbourne renal transplant surgeon Alan Saunder says as transplant rates grow, the hospital system faces a looming crisis.
If this donor rate continues, then we will need to have more surgeons and I think more or better resourced transplant teams to do that work.
Kidney Health Australia's Anne Wilson says for some hospitals the crisis is already being felt, with transplant units pushed to capacity.
What we don't want to happen, that you have people waiting for 4, 7, 10 years for, let's say, a kidney transplant in our case, and missing out on a transplant because a particular person wasn't able to work that day, or, you know, there weren't the staff available to be able to conduct the transplant, or we didn't have communication between accident and emergency and intensive care, or because it took too long to retrieve the organ. We don't want to have those kind of barriers, basically.
Submissions to a Victorian parliamentary inquiry revealed parts of that state system under enormous stress. The head of one major Victorian public hospital claimed more resources were urgently needed.
More organ retrieval, operating theatre, surgical, medical, nursing and allied health resources are urgently required to enable the Victorian system to actually translate this increase in donor organs into more quality transplants.
The Victorian Medical Director of Organ and Tissue Donation said in her submission, due to the current stress in the system, it has been necessary to constrain some initiatives in order to prevent an even more rapid rise in the donation rate. The capacity crisis was anticipated by many in the hospital sector since a national reform package was announced in 2008, establishing the Australian Organ and Tissue Donation and Transportation Authority. $151 million was earmarked to fund hospitals and specialist staff and systems dedicated to organ and tissue donation, but the focus was on boosting awareness and education to increase donor rates.
As the Organ and Tissue Authority, which is a national statutory authority, works hard to increase the availability and the number of organs that are available, that there needs to be a corresponding increase in the number of transplant services.
For a range of reasons, our hospital systems aren't necessarily able to convert that into transplants, and they are largely as a result of lack of resources, delays as far as having retrieval teams having to travel to hospitals to retrieve the organs. Those are issues that are both costly and very time consuming.
We know our hospitals across Australia are under stress, and it's important that that all states understand that they have an obligation to match the federal government's commitment in this space.
The need for organ donation is very clear, and the need for increased resources is also clear. But we've got to get the mechanisms right too.
Late today, the National Organ and Tissue Authority issued a statement saying there was no evidence that organs were being wasted in Australia due to the increase in organ donation rates. It said all state health ministers had recommitted to increasing transplant services to match the increase in donor rates.
I just think if this turns people off from donating, I just say don't.
I think it's fantastic that there's more donors and more chance for me to get a transplant sooner, not just me, the other 1,700 or so that are on the transplant list. But it's a little disheartening to find out that the resources aren't quite there. They can't get the staff, they can't afford the staff and things like that. It's a little sad, and I think it's something definitely the state and federal governments need to sit up and listen to.
Lisa Whitehead reporting.